Welcome to this explainer. If you ever feel unsteady, dizzy, or lightheaded, and you also live with anxiety or panic, you're absolutely in the right place. Today, we're going to unpack exactly why that happens, what it isn't, and the simple, practical steps you can take to start getting better. Because the truth is, your dizziness is very real, and the great news is that this loop can absolutely be broken. Now, everything we'll be discussing in this explainer is based on Understanding Anxiety and Dizziness, a plain English information sheet for patients, which was published by Australian Dizziness Clinics. It's specifically designed to translate some pretty complex medical science into really clear, actionable steps for both you and your family. So here is our roadmap for today. We'll be covering 1. The anxiety-dizziness loop, 2. The brain's alarm system, 3. Why breathing matters, 4. Why busy places feel worse, 5. Steps to break the loop, and finally, 6. Hope and next steps. Let's dive right into section 1, the anxiety-dizziness loop. I want to stop right here at the very beginning and say 4 absolutely crucial words to you. Your dizziness is real. It's so important to validate your experience right from the start. These symptoms are neurophysiologically real. You're not making them up, and it is definitely not just all in your head. Your body is genuinely experiencing these sensations, and understanding and validating that mechanism is the very first step toward healing. Think of it like a two-way street. Sometimes, out of nowhere, a physical dizzy spell hits, and that triggers the worry. But other times, intense anxiety or maybe a panic attack kicks in first, and that actually starts the dizziness. In both scenarios, you get locked into this continuous physical loop. Your dizziness feeds your worry, and in turn, your worry literally feeds your dizziness. Moving on to section 2, the brain's alarm system. Okay, get ready for a fascinating fact. Your inner ear balance organs, they are wired directly into the exact same area of your brain that handles fear and alarm. It's not a coincidence. It is a hardwired, physical, structural connection. So your balance system and your fear system literally share the exact same neural pathways. So what happens when you're anxious? Well, that alarm system sounds, your body releases stress hormones like adrenaline and cortisol. And what that does is it basically turns up the volume on your balance system, making it hypersensitive. Think of it like a car alarm that's been set way too sensitive. Your brain starts overreading perfectly normal physical movements, misinterpreting a gentle breeze as a break-in, so to speak. Your system is just on high alert, genuinely feeling more motion that is actually there in reality. Which brings us to section 3, why breathing matters. When we get stressed out or even just anticipate a dizzy spell coming on, our breathing changes. We start this fast or deep overbreathing, and sometimes it's so subtle we don't even realize we're doing it. But this rapid breathing causes the carbon dioxide levels in our blood to drop. And when carbon dioxide drops, the blood vessels in your brain actually constrict, which lowers cerebral blood flow. That sudden drop in blood flow is what causes very genuine lightheadedness, visual disturbances, and even that weird tingling in your hands or lips. You can see how this snowballs into a massive escalating cycle, right? You feel stressed, you overbreathe, your carbon dioxide drops, and boom, you get lightheaded. And what happens next? Those incredibly real physical sensations of tingling and dizziness naturally trigger even more fear. You think, oh no, something is terribly wrong, which then speeds up your breathing even more, making the dizziness even worse. It's this positive feedback loop of hyperventilation that can totally mimic a severe medical event, but it's actually driven entirely by how you're breathing. All right, let's look at section 4, why busy places feel worse. Have you ever noticed this? You might be feeling relatively fine in a quiet, predictable space, like just sitting in your living room. But the very second you step into a visually busy, crowded place, like a bustling supermarket, the dizziness just hits you like a wave. This stark contrast perfectly illustrates a condition known as space and motion discomfort. I really want to assure you here, this supermarket dizziness is a real perceptual issue. It is not just fear or agoraphobia. Remember that sensitized alarm system we talked about? Well, when you put a sensitized brain into an environment packed with fluorescent lights, highly patterned aisles, moving crowds, and complex visual information, it simply struggles to process all those conflicting signals. It is genuine sensory overload. Your brain is desperately trying to make sense of way too much motion all at once. Okay, moving to section 5, steps to break the loop. Now, before diving straight into treatment, your doctor will walk you through a diagnostic pathway to carefully ensure that any structural issues in the ear or the brain are completely ruled out. Once your physician confirms that your physical hardware is totally fine and that this is an anxiety-related software issue, you can safely and confidently focus on a clear pathway to retrain your system. And here's exactly how you do that, using a multidisciplinary stepped care recovery checklist. First up, slow, gentle breathing retraining. This settles the overbreathing and resets your carbon dioxide levels back to normal. Second is a gentle, graded return to the places you've been avoiding. Third, vestibular physiotherapy gently retrains your physical balance system. Fourth is talking therapy, like cognitive behavioral therapy, to help calm the frightened thoughts that keep feeding the loop. And finally, an occasional low-dose medicine can help bridge the gap. Just a quick heads up on that one. It may briefly worsen the dizziness for a week or two as your brain adjusts, so it's super important not to stop it early. A really crucial part of this checklist is understanding the role of avoidance. Avoiding those dizzy places, like that chaotic supermarket, feels incredibly safe in the short term, right? But unfortunately, avoiding them actually keeps the underlying problem going. It basically tells your brain that those places truly are dangerous. So, a gentle, slowly graded return to these environments, often with the guidance of a physical therapist, is absolutely a crucial part of the cure. Finally, Section 6, Hope and Next Steps. If you take away anything from our time today, please let it be this. Anxiety-related dizziness is real, it is very common, and most importantly, it is highly, highly treatable. The loop can absolutely be broken. These sensations, while incredibly scary when they are happening to you, are not dangerous. You have the tools, and there are support systems available to help you retrain your brain's alarm system and reclaim your balance for good. To get the patient leaflet and to check out the rest of this patient series, just visit AustralianDizzinessClinics.com. And please consider subscribing to support the channel. As you reflect on this anxiety dizziness loop today, I want to leave you with this question. What is one small, gentle step you can take tomorrow to begin reclaiming your balance? Thank you so much for joining me on this explainer, and take care.